Over in Malaysia, the anti-corruption campaigners there have expressed concern that the United States that returned $300 million in funds stolen from the scandal-hit 1MDB state fund. They're concerned because it was returned to an unelected government. That and more news from our EBC correspondent in Malaysia, Roby Tinawin. Hello, Roby.
Hello, Alma. Good afternoon. Here are the news for Malaysia. Malaysian anti-corruption campaigners expressed concern that the United States had returned $300 million in funds stolen from the scandal-hit 1MDB state fund to an unelected government. Billions of dollars were plundered from the sovereign wealth fund and spent on everything from a luxury yacht to artwork in a fraud allegedly involving Malaysian ex-leader Najib Razak and his inner circle. Najib was ejected in 2018 election, largely due to public anger over the scandal, and a new reformist government then began the process of recovering money stolen from the investment vehicle. On Tuesday, the U.S. Justice Department announced it had sent $300 million stolen from the fund to Malaysia, and that it had now returned or helped the Southeast Asian nation recover more than $1 billion in funds and assets lost in the fraud. The U.S. is among several countries investigating the scam. An activist group called the Center to Combat Corruption and Cronyism welcomed the return of the funds, but said it was worried they were in the hands of an unelected government which had ruthlessly seized power from the people. The group urged the government to be clear about how the money would be used. The administration voted in the 2018 election in the country's first change of power for 6 decades, fell apart several weeks ago amid bitter infighting, and a new coalition took power without fresh polls. The new government includes Najib's party, the United Malays National Organization, and there has been widespread anger that his scandal-mired political vehicle has returned to office. Najib, who denies wrongdoing, is on trial over the 1MDB scandal. Malaysia's new government has vowed to fight corruption and insists high-profile graft trials will continue. Meanwhile, Deputy Foreign Minister Kamaruddin Jaffar said India has agreed to sell hydroxychloroquine tablets to Malaysia for use in the treatment of COVID-19 patients, with New Delhi partially lifting its bar on export of the anti-malarial drug. India is the world's biggest producer of hydroxychloroquine, sales of which have soared across the world, including the United States, especially after President Donald Trump touted it as a potential weapon against COVID-19, the disease caused by the novel coronavirus. New Delhi had last month put a hold on exports of hydroxychloroquine to secure supplies for itself, before agreeing this month to supply it to some of its neighbors as well as nations who have been particularly badly affected by the pandemic. Malaysia has been using hydroxychloroquine for mild to severe COVID-19 cases along other drugs. Malaysia has the third highest number of infection of COVID-19 in Southeast Asia, with more than 5,000 cases, 83 of whom have died. India's decision to sell the sought-after drug to Malaysia signals a turnaround in relation between the countries that had soured because of repeated criticism of some Indian policies by Tun Dr. Mahathir Mohamad before he resigned as Malaysia's Prime Minister in February. The tension had also affected palm oil trade between the countries. Cadila Healthcare, one of India's leading suppliers of hydroxychloroquine, said last week it had increased production tenfold to 30 tons per month and was ready to produce more if needed. China Global TV Network, or CGTN, has listed Health Director General Dr. Nur Hisham Abdullah as one of the world's top 3 doctors born from public health officials handling the COVID-19 outbreak, alongside the U.S. Dr. Anthony Fauci and New Zealand's Dr. Ashley Bloomfield. The three were commended for weeks of calm, clear-headedness, besides being trustable sources of facts and information for their nation during the crisis. Dr. Noor Hisham, 56, who has been the Health Director General since 2013, has been called a trusted face by Malaysian. This is due to his consistent updates on the virus on his social media platforms, as well as the fact that he only uses verified data and credible sources to make decisions and inform the public. He also updates the public on social media, sometimes past midnight and in the wee hours of the morning. GTCN said, or CGTN said, his low profile and low-key unassuming air was Dr. Noor Hisham's appeal, while Bloomfield was described as the quintessential civil servant. Dr. Noor Hisham specialized in endocrine surgery and trained in various universities in Adelaide and Sydney, Australia. His work has been published in many local and international journals, while he has also written chapters on endocrine surgery in textbooks. Dr. Fauci and Bloomfield have also been reassuring and credible influences in their countries, as both men have consistently kept the public updated, giving interviews whenever possible, and also working long hours as well. Fans of Dr. Fauci and Bloomfield have even gone to the extent of setting up fan accounts on social media. Dr. Fauci has been called a coronavirus crush and national treasure by the Atlantic and the New York Times, with nearly 15,000 people also signing a Change.org petition to get him voted as People's Magazine's Sexiest Man Alive 2020. Dr. Noor Hisham's admirers have also made it a point to express their gratitude and praise him, saying that Malaysia is lucky to have him. Meanwhile, several groups championing migrant communities have suspected that the COVID-19 crisis has made Malaysians more xenophobic than they were before. Citing largely anecdotal evidence, they said they were shocked to note that the hatred of foreigners appeared to have intensified to a degree above the level reported by the International Labor Organization last December. Spokesman for Karam Asia and its partner organization, the North-South Initiative, said some Malaysians were blaming migrant workers for the spread of the virus, since they have always seen as people who don't practice good hygiene. They would point to the many Bangladeshis, Pakistanis, and Rohingya who attended the Tabligh conference in Sri Petaling and reprimand them for allegedly being late in seeking medical treatment. They also said there was a lot of fake news regarding migrant workers, including claims that they threaten enforcers of the movement control order with harm. Sumita Shantini Krishna, director of an NGO called Our Journey, said xenophobes resented the distribution of government aid to foreigners. She also said she had noticed the attitude on social media and had heard stories from the migrants themselves when she was handing out dry provision and other forms of aids. An organizer for Perteam, which is an association of Indonesian domestic workers, said she could confirm that ill feelings towards foreigners had increased since the start of the virus scare. She said there has always been a dislike of migrant workers for many reasons, but they are now blamed for the outbreak. Some are saying the migrants carry the virus because they are dirty. Alex Ong, a coordinator for Migrant Care Malaysia, criticized some NGOs that recently complained about foreigners being allowed to live in Malayan Mansion and Selangor Mansion. He said, this is a form of xenophobia. I don't think they deserve to be NGOs. Meanwhile, the Education Ministry has announced the postponement of two major secondary school examinations here in Malaysia, SPM and STPM, as well as the cancellation of the Year 6 Primary School Achievement Test, also known as UPSR. Now, Education Minister Radzi Jidin said the SPM examination for 2020 will be held in the first quarter of next year. He also announced the STPM Semester 2 examination has been changed to August 2020, while the Semester 3 examination will be held in the first quarter of 2021. Radzi said the new examination dates would also mean new dates for university intakes. He said the ministry would introduce an alternative method to evaluate students who are supposed to sit for the UPSR and PT3 examinations. Schools in the country have been closed since March 14 due to the first-term holidays and the movement control order, which started on March 18 and has been extended to April 28. He said the cancellation of UPSR will not affect the students' evaluation since they can be carried out through various other methods. He said the same measures would be applied for PT3 students to ensure that they are able to enroll in hostels and other technical schools. On the effect of postponing SPM and STPM on admission to institutes of higher learning, Radzi said the Higher Education Ministry has agreed to postpone enrollment into basic, matriculation, and diploma programs until July or August 2021, and degree programs to September or October 2021. He said it remained uncertain when schools could reopen, but assured that his ministry is looking at implementing social distancing in all classrooms. Now, the Penang Water Supply Corporation, PBA, has warned of low levels at 6 key water dams in Kedah and Penang, urging the government to carry out cloud seeding operation in the northern states of Malaysia. The northern region generally experiences heavy rain in the first 2 weeks of April, but this year has been an exception as the weather has been abnormally dry. PBA CEO Jasini Maidinsa said cloud seeding could help prevent a water shortage during the movement control order implemented to curb the spread of COVID-19. He added that access to water is key in the struggle to contain the virus spread. He said it makes good sense to implement cloud seeding to induce as much rainfall as possible. The 6 dams in question serve some 3.95 million people in Penang and Kedah. As of yesterday, Kedah's Muda Dam recorded the lowest capacity at 4.4%, while the other 5 dams recorded capacity between 20 to 68%. Meanwhile, Penang Chief Minister Chow Kon Yeow said Penang government will pay for cloud seeding operation to ensure rain at water catchments that are drying up so that people will continue to receive an adequate water supply. The Chief Minister's office estimated the cost of cloud seeding at 27,000 ringgit a day. In a statement, it is said that Penang had 8 days of cloud seeding last year and 4 days of cloud seeding in January. Now, a study has shown people with COVID-19 may be infectious days before symptoms, according to a new modeling study published last Wednesday. The study comes as nations have broadened restrictions aimed at curbing the epidemic amid concerns over patients who may be infectious despite not showing any signs of ill health. The findings challenge key assumptions behind measures put in place to stop the spread of the pandemic, such as tracing contacts of an infected person only as far back as the time at which they began to show symptoms. Experts have long conjectured that some people who do not even know they are infected may transmit the virus. But a new study suggests that even those who get visibly sick may be highly infectious before the onset of symptoms. Researchers compared clinical data on virus shedding from patients at a hospital in China with separate data on transmission pairs, where one person is believed to have infected the other, to draw inferences about periods of infectiousness. The research team, called by Eric Lau of the University of Hong Kong, took throat swabs from 94 patients admitted to Guangzhou 8 People's Hospital and measured infectiousness from the first day of symptoms for 32 days. They found that the patients, none of whom were classed as severe or critical, had the highest viral load soon after the onset of symptoms, which then gradually decreased. The study used publicly available data on 77 transmission pairs within China and internationally to assess how much time elapsed between the onset of symptoms in each patient. It assumed an incubation period, the time between exposure to infection and appearance of symptoms, of a little over 5 days. The author inferred that infectiousness started 2.3 days before symptoms appeared and was at its peak at 0.7 days before the first signs of illness, although they cautioned that pinpointing the exact timing of the onset of symptoms relied on patients' memory. They estimated that 44% of secondary cases in the transmission chains were infected during the pre-symptomatic stage.
Okay, so
Infectiousness was
Ruby,
predicted to decrease. Yes, Alma?
yes, so you're saying that the study is saying that you can transmit the virus even though you are asymptomatic. Am I getting it right?
Yes, Alma, and it also saying that it can start to be transmitted even before you start showing symptoms.
Oh, okay. All right. Thank you very much, Ruby, for all that update. And I'll see you soon tomorrow for more updates there in Malaysia. Thank you so much for your time.
Yes, from EBC Malaysia Bureau, this is Ruby Tinawin. We live in interesting times.